I buried my first heroin friend who died of heroin in 1969, but I've never seen anything like it is today. If 1,500 people died every year in car accidents in this province, the speed limit would be 5 miles an hour. I'll look into it. That's all I need to do.
Dean Wilson has done heroin for the better part of 50 years. He's on opioid replacement now, but he lives in the middle of the overdose crisis. Wilson is one of the people behind the proposal for a heroin buyers club in Vancouver's downtown east side.
Let's get off sitting on our hands. We've got to do something. If it isn't this, do something. We're dying.
The new idea is to create a co-op where people assessed by health professionals could become members and buy pure medical-grade heroin. It's a bold concept, but in the context of the overdose crisis, killing about 4 British Columbians each day, people are getting desperate. The idea took inspiration from the Cannabis Compassion Clubs or the Dallas Buyers Club, which gave patients access to life-saving medication during the peak of the AIDS epidemic.
If we regulate and control access to heroin to those with severe addiction, people addicted to fentanyl, and co-locate those services with addiction treatment and recovery-oriented services as well as public health services, we can probably have a dramatic benefit to British Columbians by waging economic war on organized crime.
The Heroin Buyers Club has the support of the provincial health officer, but Dr. Bonnie Henry says it will have to be done cautiously and studied carefully.
I will do my best to advocate for it. I'm not the one who makes all of the decisions around particularly things like funding programs, and I am advocating with the federal government around some of the restrictions under the Controlled Drugs and Substances Act that need to be lifted to allow this to happen.
This is a new proposal. I have not had the opportunity to review it yet. Ultimately, the decision on this would be the federal government's.
Which sends the ball into the federal government's court. Health Canada says it takes a compassionate, evidence-based approach to drug policy. One change the federal government has made is making it possible for doctors to prescribe heroin. Wood says the BCCSU hopes to see its vision become a reality within about 6 months. But first, it will have some significant hoops to jump through if it's going to be done legally. Rafferty Baker, CBC News, Vancouver.